Hey, good morning, everyone, and welcome to UroNurse. I'm your host, Vic Sinise. Welcome to the show. Beautiful spring day out there. I don't know how it is by you, but all the flowers are blooming all over the place by me. So, getting ready to enjoy Easter tomorrow. So, hopefully, you're going to have a great celebration too. Hey, if you're joining us live, welcome. We'll come to you on YouTube, LinkedIn, Facebook, X. Even Instagram was coming through on us today. So if you're watching us on any of those channels, please like, subscribe, hit any button you can find. Just go ahead and let us know you're there. And then welcome to all our live viewers over StreamYard too. Put your name in the comments and where you're from. If this is your first time checking us out on UroNurse, be sure to go to our website at uronurse.com. Best place to learn more about the show. And hey, there's other podcasts that I put on. You can find out more about those podcasts. We got great sponsors. You can visit their websites too. So be sure to check out uronurse.com. Also, the best place to go to watch all of our past episodes. And boy, we got a bunch of them out there. 100 and this is 142. So 142 to choose from. A lot of you like to listen in the car. That's a great idea. Got a long commute? I do. And just pop us in there. Any of your favorite podcasting apps, Apple Podcasts, Spotify, iHeart, Amazon, YouTube Music. We're on them all. So real simple. Just go over there and subscribe and you'll get it delivered to your mailbox as soon as it comes out. I produce these about every episode. I do it about a half hour after the episode ends. So they come out pretty quick. Now, this week, I'm real happy to have Gina Powley from Hollister joining us. She's going to be talking about the innovation to improve patient outcome and talking about their great products. So let's go ahead and bring Gina in right now. Gina, welcome to the show. How are you doing?
I'm doing great. Thanks so much, Vic, for having me today.
Yeah, it's glad to have you on. Why don't you tell the audience a little bit about yourself, how you got involved in Hollister, and what other things you're involved in?
So I've been a clinical resource manager for Hollister Incorporated for almost 4 years. My previous life, I am a certified urology nurse practitioner. So I practice in St. Louis, where I live, as a nurse practitioner for almost 16 years. I've been a urology nurse for almost 30 years. So urology has been
Goes
my
fast,
passion.
doesn't it?
It does go fast. I tell you what. It's crazy. And, urology is in my blood. And so I had this wonderful opportunity to join Hollister. And actually, one of my dear friends who is a SUNA member and past president, like you and I both are,
Yeah.
she was a clinical resource manager and helped me get into this position. So I love educating clinicians about catheters and bladder health and bowel health, because we really do help a lot of the rehab patients, with STI, Parkinson's, MS, any patient with neurogenic bladder, really. And it's just been a great way to spread my knowledge across the
Yeah.
country, really.
Yeah, and I think that's, as nurses, I think that's what we're always doing is wanting to educate patients. What's the best thing out there? Having struggles, taking our experience and trying to make it better. And I found that this show has been great for introducing different products. Even as much as we try to keep up at meetings and stuff, there's so much coming out so often that it's really hard to keep up. So we're doing our best by getting great companies like yours to present.
Thanks. And you're right. You guys have had such great topics. I listen quite often. And if I can't join on Saturday mornings because I travel a lot, I
Yeah.
do watch your podcasts and or watch the episodes on
Mhm.
YouTube, and they're great.
Yeah.
I highly
Oh, great.
recommend to all my clinician friends. So,
Let's go ahead and bring up your slides and let
all
you
right.
talk us through the great products from Hal.
All right. So we're going to talk about innovation to improve patient outcomes. And if it wasn't for industry to help keep innovating, we're really doing this for our patients, the people who use these products. And so it's not just Hollister, it's not just catheters, it's all the products out there that people need to improve their quality of life when they have healthcare issues. So, what are we going to talk about this morning? I'm going to discuss urethral trauma, prevention, and consequences, we're going to define friction force and the impact of friction force of an intermittent catheter. I'm going to explain our new hydrobalance lubricating technology, and we're going to explore the clinical benefits of 100% no-touch protection and complete bladder drainage. But before we dive into urethral trauma, we must first understand the anatomy of the male and female urethra. So I'm just going to talk quickly about the urethra. It's comprised of an outer circle muscle, an inner longitudinal muscle, submucosa, and epithelial lining, like the lining of your cheek. And then, of course, we have the lumen. The male urethra has the same layers. However, the prostatic urethra is lined by transitional epithelium. The bulbar sponginosus muscle surrounds the bulbar urethra, and the membranous urethra is surrounded by the striated external urethral sphincter. So with the male urethra, the adult male is approximately 18 to 20 centimeters long, and it's 7 to 10 millimeters in diameter that carries semen and urine from the ejaculatory ducts and the bladder, extending from the bladder neck to the tip of the penis. It's divided into three main parts: the prostatic urethra, membranous urethra, and penile urethra, consisting of the bulbar and pendulous urethra. The male urethra bends about 35 degrees at the midpoint of the prostatic urethra anteriorly. The female urethra is about 4 centimeters long and 6 to 8 millimeters wide. The urethra ends between the clitoris and the vagina. The female urethra only carries urine outside of the body. The mucosa and submucosa are crucial for maintaining continence and depend on estrogen levels. During menopause, the decline in these hormones can cause urethral atrophy, resulting in urinary symptoms such as frequency and urgency. And trust me, this was the population that I saw a lot when I was in practice. This atrophy may also lead to bacteriuria in older postmenopausal women. But we would be remiss if we didn't talk about the pelvic floor. It is a complex structure composed of bones, muscles, and ligaments, and fascia. It plays a crucial role in supporting visceral organs, maintaining continence, and aiding in urination and bowel movements. Both men and women have a pelvic floor. So men are 5 times more at risk than females for urethral trauma or injury. Urethral injuries are relatively rare and are often associated with severe trauma, childbirth, and improper catheterization. In men, injuries are classified as anterior or posterior, where the anterior has the penile and bulbar urethra. These injuries typically involve a crushing mechanism, while the posterior, which is the membranous and prostatic, these injuries involve shearing forces. Other types of urethral trauma include iatrogenic and idiopathic. The Webster Dictionary defines iatrogenic as induced unintentionally by a physician or surgeon or by medical treatment or diagnostic procedures. Idiopathic is explained as arising spontaneously or from an obscure or unknown cause. The most common form of iatrogenic trauma is due to catheterization. Instrumentation or surgery can also cause iatrogenic urethral trauma. However, there are non-negligible side effects of IC, such as inducible urethral trauma, microtrauma, urethral stricture, bladder stone, and false passage formation. Uncoated catheters can elevate friction between the catheter and the urethra, heightening the risk of injury and bleeding during catheterization. Reducing the coefficient of friction or friction force in intermittent catheterization is crucial for minimizing microtrauma to the urethra, which significantly enhances the user's quality of life. To help us better understand, this picture depicts what the healthy urethra looks like. Here again, you see the urethral layers now from a longitudinal cross-section view. From left to right, you have the circular urethral muscle, longitudinal urethral muscle, submucosa with blood vessels, and at the side of the lumen, the epithelial layer, which will be in contact with urine or the catheter. This picture shows urethral trauma. You can see that as well as the epithelium, the submucosal layer is affected. And this gives you a look at both healthy and unhealthy urethral tissues side by side. So as defined by stat pearls, normal red blood cells seen on microscopy is 0 to 5 cells per hyperreal field. Any red blood cells seen over this amount could be a result of UTI or inflammation. Normal urine is light yellow and clear. Macroscopic urinalysis notes the amount, color, and clarity of the urine, as well as any other visible characteristics of the urine, such as the presence of blood clots, precipitates, or sediments. What can the urine look like from urethral trauma? Urethral bleeding episodes are common, impacting up to 1/3 of patients undergoing long-term intermittent catheterization, particularly males. In a systematic review and meta-analysis by Liao et al., there were 3 trials and 12 studies for microscopic hematuria in their study. The incidence of microscopic hematuria was 41.7% in patients using hydrophilic catheters, but 56.3% in patients using non-hydrophilic or gel-coated catheters. The difference between these two groups was statistically significant, indicating that the risk of microscopic hematuria with hydrophilic catheters was only 69% of that in non-hydrophilic group. The sequelae of urethral trauma, particularly the increased risk of UTIs and potential long-term complications like strictures, are significant. Symptoms of pain and bleeding are commonly used to describe urethral trauma, while the presence of hematuria often indicates the trauma severity. The long-term impacts of urethral trauma, such as stricture formation and its effect on quality of life and bladder management, are acknowledged as significant concerns. Autonomic dysreflexia is a complication that can occur in people with SCI. It's the sudden increase of blood pressure, 20 milligrams of mercury systolic or higher than normal, as a response to pain, pressure, unpleasant or pleasant stimuli happening below the level of injury. Since autonomic dysreflexia can be a response to pain, any trauma to the urethra can cause autonomic dysreflexia. It's important when treating patients with SCI to remember this can occur due to urethral trauma of any kind. So how do we prevent urethral trauma? Atraumatic catheterization involves using the correct catheter size, adequate lubrication, and carefully guiding the catheter through the urethra, sphincter, and bladder neck. Now let's move on to another topic related to urethral microtrauma, friction force. What is friction force? It's the force that is generated by two surfaces that contact and slide against each other. For instance, a catheter that comes in contact with the urethral wall. Laboratory tests evaluate lubricity performance by measuring friction force by simulating urethral insertion and withdrawal. A lower friction force In an intermittent catheter means that the catheter will move more smoothly and with less effort through the urethra. The goal is to minimize discomfort and microtrauma. A lower friction force ensures less discomfort during catheterization, reducing the risk of microtrauma and urinary tract infections. So friction force is tested in a laboratory setting. It's in a controlled environment. A catheter is inserted and withdrawn from a urethral model, which yields a measure of force from the catheter on the surface of that urethral model. The lower the friction force number, the less friction there is, which means the less microtrauma or trauma to the urethra. So now that we've discussed the drawbacks of catheterization, especially when the catheter has a higher friction force, let's discuss the new lubricating technology recently launched by Hollister, HydroBalance lubricating technology. HydroBalance lubricating technology is inspired by nature. Being inspired by nature means providing end users with a more natural catheter experience and in turn making them more confident in their catheter experience. The 3 key features to remember about HydroBalance lubricating technology: it's smooth and comfortable for the patient to insert and withdraw due to the cushioning effect we will discuss in the next slide. Because of this smooth insertion and withdrawal, it also helps protect the urethra from potential microtrauma and UTI. It is designed to mimic the urethral balance of ingredients to make catheterization as natural an experience as possible. How does HydroBalance lubricating technology achieve this natural experience? Using a cushioning effect and longer lasting lubricity helps protect the urethra from potential microtrauma. With the new coating and hydration fluid, the catheter has a sort of cushion around the tubing. This enhances the smoothness of the insertion and withdrawal. The key ingredients of HydroBalance lubricating technology is glycerol, which is naturally produced by the body. The glycerol, as opposed to just sterile water, allows the osmotic water balance to be maintained in the urethra during catheterization. This prevents water from moving from the catheter to the urethral tissues and therefore longer lasting lubricity. HydroBalance lubricating technology is also better for the planet. Our new catheters with HydroBalance lubricating technology are made without PVC and reduced packaging material. This process to produce catheters with HydroBalance lubricating technology also decreases manufacturing waste, which is wonderful for our environment. So now, what do end users have to say about the new HydroBalance lubricating technology? A clinical study was executed in the US with 61 end users to try HydroBalance product. 90% stated the catheter with HydroBalance lubricating technology had better or the same lubrication as the current Vapro catheters. 100% of these end users found removing the catheter to be very easy, or felt neutral about it. But we want to note only 5% found it neutral. 90% found inserting the catheter with HydroBalance lubricating technology easy or very easy. This is important data to show how satisfied end users are with the new HydroBalance lubricating technology. And this is the portfolio with the HydroBalance lubricating technology that Hollister has. So now, how does HydroBalance lubricating technology compare with the friction force to other lubrication on the market? When compared to prior versions of Vapro catheters, HydroBalance lubricating technology shows a significant improvement in friction force on insertion and withdrawal. When testing friction force on insertion of catheters, Vapro catheters with hydrobalance lubricating technology were found to have 4 times lower friction force than Coloplast SpeediCath Flex and Luja catheters. The testing showed that it provided a similar friction force when compared to WellSpec low-fric Origo catheter. Remember, this is just the insertion of the catheter when the catheter is freshly out of the packaging. When testing friction force on withdrawal of the catheters, Vapro catheters with hydrobalance lubricating technology were found to have 54% lower values of friction force than Coloplast Luja and SpeediCath Flex catheters, as well as the WellSpec low-fric Origo catheter. Here you can see a chart depicting the consistency of data on insertion and withdrawal friction force. More consistent friction force data leads to a more predictable catheter experience. Vapro catheters with hydrobalance lubricating technology provide consistently low friction and low friction force variation. As a result, allowing users to rely on the catheter to glide smoothly, both on insertion and withdrawal. So what can we conclude from this data? By reducing friction, hydrobalance lubricating technology offers a smoother and more comfortable experience upon insertion and withdrawal. This helps protect the urethra from potential microtrauma and urinary tract infections. Catheters must be inserted and withdrawn. Therefore, it is the combined performance of insertion withdrawal friction force that makes Vapro catheters with hydrobalance lubricating technology the catheter with the best performing lubrication among the catheters tested. Catheterization can be a scary process. By ensuring consistency of the friction force performance, users can rely on the smooth performance of Vapro catheters with hydrobalance lubricating technology. Now that we've discussed new hydrobalance lubricating technology, let's review the other benefits of Vapro catheters to promote excellent patient experience and care. With Vapro catheters, tip and sleeve, it's the only hydrophilic intermittent catheter on the market that offers 100% no-touch protection. The protective tip and protective sleeve help shield the catheter from bacteria during the catheterization process and helps reduce the risk of carrying bacteria into the urinary tract. Vapro catheters, 2 optimally designed smooth rounded eyelets, along with this 100% no-touch protection with the cap, tip, and sleeve, promote complete bladder drainage and protection for bacteria that cause UTIs. This makes Vapro catheter the superior choice for intermittent catheterizations. And here are our references. And thank you very much.
All right, Gina, that was great. Great presentation. So
Thanks,
I'd like to
Vic.
welcome everybody that's joined the show. Charlene, Diane, some of our regular fans out there on StreamYard, and a bunch of you on X today. Be sure to send in any comments if you're on Facebook or YouTube or StreamYard or LinkedIn. We've got some LinkedIn's out there. You can send those in. I can actually see those on my program. Unfortunately, you X folks, I don't get to see yours until after the show, but you're welcome to put comments on any of those other, comments or questions on those. So I'm going to kick it off though with a question for you, Gina. So
Sure.
this new product line, this new coverage, the I'm going to
Hydrobalance. Yes.
Hydrobalance. Thank you. Is that found on all your catheter line now?
It's on all the hydrophilic catheters. Actually, it was on our Infina Chic and only Coude catheters before it actually got on our Vapro catheters. So it's been on only an Infina Chic. for about 2 years. And it just was launched on our vapophilic catheters. In the United States, probably the end of last year, the beginning of this year.
Okay. So you don't have to worry about whether you're getting the best catheter or not. Any catheter you order, you're getting Hollister's best.
You're getting Hollister's best.
Great. Fran, I forgot about you. I see you in there now. A great presentation from Fran.
Hi, Fran. So nice to see you on with us.
Yeah, you get to see a lot of our old SUNA friends, our young SUNA
Young
friends.
SUNA, yes, please, young.
Joining us on the show. It's always fun to have you on board. So in educating a patient, how do you kind of think about which catheter you would tell them to use out of your lineup? I mean, is there one you choose over another?
It all depends on the patient's dexterity and their needs. So in the urology space, with the female catheters or female who needs to use intermittent catheters, I always want to try them with ANP-BC. The ANP-BC is our pink catheter that is very appealing, discreet, and it's used, when you're using it, you can pop it open with one hand. You can put it down on the counter or a table, or even if you're in a public restroom, you could put it hopefully on, if they don't have a 2-round of a toilet paper holder, but you can lay it down and then you can pop the catheter out with just one hand and then insert and remove the catheter after you drain the bladder. You can put it back in the case. And the nice thing about the case is that it has a great O-ring that seals in any liquid that may be left in the catheter. And then once it's sealed tight, no liquid or odor can be smelled or felt. So you can't see the liquid. The liquid isn't going to come out. You can't smell any of the odor because once a catheter is used, as we know, the urine can start smelling after some time.
Yeah. And I think that's an important point is being able to, what do you do with the catheter when you're done? I mean, it's not like you can flush them down a toilet and then walking through the public restroom with this, thing and.
Right. And it's so important for women. I mean, it's important for men, but I think especially young girls, who have spina bifida that are having to perform intermittent catheterization, it's really important for them. Now, for a man who needs intermittent catheterization, we have the Vapro Coude. Now, our Vapro Coude still does not have the hydrophilic or the hydrobalance lubricating technology, but it is going to be on it soon. Just don't have the exact time, but hopefully by the end of 25 or the beginning of 26, it'll be on our Coude catheters. So right now it's on the Vapro Plus Pocket, Vapro Pocket, ANP-BC only. A Coude is perfect for those men with an enlarged prostate, but our Coude has that protective tip and sleeve and cap, which gives them that 100% no-touch protection for UTIs. It's great if you have a patient who has been on intermittent catheterization and is getting those recurrent UTIs. It's one way that you can offer them a solution to decrease their UTIs, if not eliminate them completely.
Now, is there a requirement like documented 2 urinary tract infections to provide that catheter or?
For the Coude catheter, the only thing that you need is the Coude requirements. That is, you're unable to pass a straight catheter due to anatomical variance. It's easy to get that Vapro catheter Coude for that male patient. Now, when you're talking about the Vapro Plus, the Vapro Plus Pocket, or Vapro Pocket that has the straight tip, cap, tip, and sleeve with a bag or without a bag, those are considered a closed system. So you do have to either have a T3 or above spinal cord injury, have 2 UTIs documented in the patient chart in a 12-month period, and they also have to be symptomatic. So Medicare really makes us document quite a bit to get coverage of those closed systems. But most SCI patients have 2 UTIs very quickly. or if they have the high enough injury, they automatically qualify.
And how is this coating activated? Is it already activated when you
It's
take it
already
out, or
activated. You don't have to pop a sachet. You don't have to drain any liquid. It's right there, ready to go. And if you've used our Vapro Plus or Vapro Plus Pocket
Mhm.
catheters in the past, you're going to notice that it's not as wet. So the lubrication is actually a foam lubrication that's inserted into the sleeve, and then that foam dissipates, and so you just see that liquid. And it's a great new technology.
I
So
have to I have to
here's
confess that I've opened a few of those myself and gotten all wet from the
yes,
catheters,
yes,
leaking on
and
me.
it has been, a deterrent for some patients. But to remember, it is water, so it is not going to stain any fabrics. And
Yeah.
so the one thing that I would always do is I always wear black pants and I wipe it on my black pants and I'm like, guys, I've been doing this all day. It doesn't stain. It is just water. But now it's not as much liquid. So people are really happy about that.
Yeah, that's good. Question coming in here. What educational materials or support does Hollister provide to new users, or I guess even past users?
Past users. Hollister.com has so much information for patients. We have instructional videos, we have guide for uses, we have testimonials by other end users. We have um, short little instructional information sheets that talk about how to prevent UTIs, how to manage your bladder and bowel. We have for clinicians coffee and learns. So, as of last year, we've started offering one free CE for our coffee and learns. So this year we'll have 6, and we have them in the afternoon, sometimes in the evening. It just depends on our speaker. And I try to do it different time zones or different times for the different time zones. And we have clinicians from usually 5 different countries on our coffee and learns. But these then are on our website under clinical education for clinicians to go back and watch. We have a varying topics that may be specific to rehab, specific to urology, or for any clinician. We have neurogenic bladder, tips and tricks for difficult male and female catheterization. We've done neurogenic bladder. We've done autonomic dysreflexia. So we have such a variety of topics, not as many as you do, Vic, um, but we cannot offer the CE after the live presentation. We can only offer them
Mhm.
while it's live.
Yep. Oh, great. And hey, anything that includes coffee,
That's
I
right.
take it bring your own, right?
That's right. We started these coffee and learn during the pandemic. We wanted
Mhm.
a way to reach clinicians, and actually, my wonderful prior counterpart, Mary Wasner, she was the one who started these. And then when I joined Hollister, um, it was about 4 years ago, I took over the coffee and learn. And then, like I said, last year we expanded, and now they're an hour long and for a free CE.
Yeah. And hey, I found one thing I found out is because we offer CEs now through some of our programs
Yes.
on UroNurse, and people love it. That free CE is so convenient. State of Illinois, we have to have 20 CEs to re-up our license. So,
Exactly.
and
And,
those that are involved in SUNA that are certified need to keep up. So,
exactly. There's a few states that don't require CEs, but so many states do. But it's
yeah.
just so important for nurses to continue with their education. But a lot of offices don't pay for CEs any longer. So it
Oh,
is so
yeah.
important for clinicians to have an opportunity for free CEs because it is expensive. I have one of my regional managers. His wife just became a nurse practitioner and started in a urology practice about a month ago. So it's kind of fun talking to him and his wife now that she's in the urology space.
Hmm.
And he said it cost her almost $450 to purchase a package of CEs.
Yeah.
So he's going to make sure that she joins our Coffee and Learns. And I've even told him about this, your
Yeah. Check
podcast
out UroNurse.
and UroNurse, web
We're
event.
trying to get about once a month or so now, trying to get a
Yeah.
CE involved. It's
And
got
it's
another
wonderful.
question for you. So, in your experience, how does the cost of Hollister products compare with other brands, especially for long-term users?
So our products are covered by insurance, just like every other product. Um, if the patient has a copay, they may have to pay part of the copay.
Mhm.
But most of the time, the patients love the products, so they're willing to pay a little bit out of pocket to have a better catheter experience. But they are covered 100% by insurance unless the patient has a deductible, and it's
So
covered by
patients,
Medicaid,
they
Medicare,
can get whatever catheter they want covered by
whatever
their
catheter they
insurance,
want.
not brand specific or
Right, right. Not brand specific. And oftentimes, if they say it's not covered by insurance, it might really be the DME who's saying that it's not covered when it really is covered, but it just doesn't give them the widest margin.
all
So
right,
as a
good.
nurse, I learned all of that so many years ago, way before I worked in industry. Um, it's so important to know this information for your patients
Yeah.
because you want them to be on the product that they choose. And I always want patients to have what they choose, whether it's Hollister product or whatever other product, because they have to be able to be comfortable with their catheter. They have to be able to do it on a regular basis because we want to protect those kidneys, and prevent the UTIs. We want to have the best experience. And whether it's our catheter or another catheter, I want them to be able to catheterize on a regular basis. Like I said, we're urology nurses. We want to protect the whole urinary tract.
Yeah. And Hollister provides free samples for patients
Absolutely.
to try. So
Yep.
somebody's out there, I'm a patient, I've been using a catheter, but hey, this new Hydro Advantage, I know
The
I'll never get
hydrobalance.
that.
Yeah.
I'll
I've
never
never
get that
heard of
name.
it.
They should have
Now it's,
used initials.
that's right.
But anyway, and I'm thinking maybe I'd like to try it. I could definitely give this a try,
Yep.
and then, like you said, the
Absolutely. Yeah.
insurance should cover it.
You can request samples from the website.
Yeah.
There's
I know
numbers
I
that
know
come.
is one of my biggest pet peeves as somebody who's been teaching patients how to do catheterization for years is typically I think it's our responsibility to kind of guide the patient into what products are probably best. And
Right.
we should be on top of our game and know. But then you go ahead and you found the catheter you want for the patient, you order the catheter and you go through some company that comes into your office and they substitute something and
Right.
they tell the patient this is just the same, and it's not. They come in, they've got problems. I'm having trouble, I can't catheterize, and I find out they're using some junk catheter. It's just they're
Correct.
not all the same, and many of them out there are good, but not all of them. So
Right.
it's disappointing. And I as soon as I find that out, I go, okay, that's one of the companies I no longer use. So most
Yeah.
of them are really good. If you say this
Most
is
of
what I
them are.
want, they're going to take care of it.
Right. But I found that too as a clinician. When I found out that they switched the patient out from the catheter that I prescribed, you get a little angry because I know what's best for my patients. I've talked to them, I've trained them, and I don't want some company saying, oh, no, this is what you get.
Yeah.
But I don't know if you've heard, Vic. So CMS is changing HCPCS codes for catheters. January
No, I
1st of
haven't.
2026. We're expanding, or they're expanding the HCPCS codes. So, we've been nurses for a long time in urology. There's only been 3 codes for so long.
Right.
You have the 84351, 52, and 53. So we have the straight, coude, curved tip, or the closed system. Medicare is expanding it, so it's going to separate the hydrophilic from non-hydrophilic catheters.
Hmm.
So AE Home Care was a coalition that they actually partnered with all of the manufacturers. So it's with Coloplast, WellSpect, Hollister, SUNA, AUA.
Mhm.
So More to come, but right now what we know is that there's going to be 6 codes. There's no change in reimbursement from Medicare for
Mhm.
hydrophilic or non-hydrophilic. The documentation is going to be exactly the same, but you may start seeing this in the near future. I know I had a clinician say, "Hey, yeah, my 180 rep told me about this." I'm like, "Yeah, it's coming out. We haven't really talked about it a lot, but you can see more information on AA home care." But by January 1st, it's supposed to be implemented. But you know how government is.
Yeah, right. It changes so fast you can't keep up with it sometimes,
Yeah.
at least recently. All right, I got another
Recently,
question
exactly.
here. What improvements or innovations would you like to see in future generations of Hollister self catheters? Any great ideas that you think
Wow.
they should be looking at, or what you'd like
You
to
know,
see? Anybody in the audience has an idea, feel free to throw it
right.
in the
And honestly, now that we have this new lubrication, that was where I had the most, pain points, I guess, is the lubrication because it was great on insertion, but we know we have those patients that have larger bladder capacities that it takes longer to drain.
Mhm.
And so if it was in the urethra, maybe more 5, 6, 7, 8 minutes, it would stick a little bit. You'd have to kind of break that seal because the water was being sucked in by the urethra. So now with this lubrication, I mean, I really can't see anything um, different right now that
Mhm.
Hollister could provide. But if
Yeah.
anybody has any suggestions, please let me know because I can always pass it to people who need to know this
Yeah.
information.
All right. Just looking through the comments, see if anything came through. Nope. Nobody out there's got any great comments. That's fantastic. I mean, I think we really covered quite a bit on catheters. Um, so I don't have any other questions that I can come up with. I'm gonna just go ahead and bring in a little bit of an introduction about next week's show.
Have you ever seen a purple color in urine bags? It's not just a bizarre sight. There's a scientific reason behind this unusual phenomenon. This purple hue often points to purple urine bag syndrome. Understanding it is vital for caregivers and loved ones. Let's break it down. Bacteria in urine decompose compounds, common in catheterized or bedridden patients. When metabolized, bacteria produce pigments, like indigo, which creates a purple color in urine. In summary, a purple urine bag usually indicates purple urine bag syndrome. Watch April 26th at 9 a.m. Central Time to learn more.
Yeah, that's gonna be next week's discussion. I did send a survey out, and I'd like to thank everyone who participated in it to kind of find out where people are with purple bag syndrome, how much they know about it. And Todd Thompson, if you don't know who he is, he's really the catheter pro on all chronic catheter issues, is going to join me for this discussion next week. So it's gonna be a lot of fun. I'm sure you've encountered some of these purple
Oh,
bags in your career.
absolutely. Patients that would come in and be like, "Oh my God, what's going on?" And
Oh, they
let
freak out.
they
And
totally
and the
freak
worst
out.
part is, and I think that's one slide with the woman kinda holding her nose. I
Yeah.
mean, these things reek. You can tell
Oh,
that patient before they get in the office because it just smells.
yes,
So it's,
yes.
not a great thing, not talk about, the way to not live, not good quality of life.
Correct. Correct.
So definitely join us next week for that because,
I'm looking forward to hearing more about it.
yeah, I think we're gonna try to uncover some secrets, that we may not always think about on how to get rid of that. And,
Yeah,
intermittent catheter is always a good way too, because if you get rid of
exactly.
the bag, it
Get rid
won't
of
be
that
purple.
Foley. Right.
Yeah.
We want, and most people can learn intermittent catheterization, but, they just have to be taught the right way and have a clinician who's patient.
Yeah. And I think it's key to find the opportune time to tell somebody, about
Exactly.
catheterization. When they first go into retention, not a good learning experience. I mean, they're
No,
freaking out. They're not hearing half of what you tell them. But,
exactly.
when they gotta come back and they're coming back, every 6, 8 weeks, whatever your protocol
Right.
is, to get the catheter changed, and you say, there is another way, instead of wearing this bag, they start to
Exactly.
think, "Oh, maybe I could try that."
Right.
So I'm always a big fan on trying to convert people out of, permanent catheter and into intermittent catheterization.
I was too, and it really does improve the person's overall kind of how they perceive themselves. Because when you're carrying around a bag of urine all the time, you just don't want to do all the things that you typically do.
Right. You start to isolate from, the world because you're embarrassed.
Right. You want people to see it.
Yeah.
And so intermittent catheterization is a great way to get rid of that purple bag.
Yep. Well, Gina, it's been a blast. Had fun talking to you.
So much fun being here with you, Vic.
We don't get together enough, so it's always nice to do it virtually. All right, everybody. We'll see everybody next week about that purple bag syndrome.